My dear students, for the last session we have discussed about what is the meaning of blood pressure and what are the types of the blood pressures and everything we have discussed for the last session. Whereas today my session is going to be the sites of measurements of blood pressure. My dear students here, so there is a blood pressure is one of the thing for maintaining of all the body parts and for maintaining of all the body activities. In that case we need to know how to measure the blood pressure. So here the sites of measuring of blood pressures are there. So there are the different kinds of the sites are there. So most probably if you're going for the hospital in the case of any kind of the problem, the doctor or nurse can go for this checking of such a kind of the instruments, whereas we know the lot of the sites are there. So most probably there are the four sites of checking of our blood pressure. The first site is radial artery site, and second one is posterior tibial artery, and third one is brachial artery, and fourth one is popliteal artery. So here these are the locations, these are the sites where exact the blood pressure we can measure. My dear students, why we need to measure the blood pressure? As I said for the previous class, the blood has pressure, it is only indicating, it is only determining the person whether the person is normal or abnormal. Dear students, that's what when we are going to measure the blood pressure, we must make sure ourselves whether we are checking the blood pressure normally or some we are going to misplace. So when you are going to instrumenting, or when you are going to placing over there, when you are going to palpating, when you are going to auscultation, everything must be in the perfect position. Then only you will get accurate data of the blood pressure. My dear students, there is a exact accurate positions are there. It is depending on our pulsation. You know, the pulse sites are lot of pulse sensation sites in our human body, as we know that. So here, so mostly we are preferring four pulse sites. So the first pulse site is a radial pulse. You can feel, everyone can get the radial. This is actual radial pulse. So here the first site we can check the this blood pressure, and second one is posterior tibial artery. So this is called, the artery name is called as posterior tibial artery, and here also we can select the measuring of blood pressure. This is the second location where we can select and where we can do the measuring of blood pressure, my dear students. And third one is brachial artery. I can say this is most probably within the hospital clinically we are using. So 90% or 95% of the hospitals and 95% of the patients, we are going to measurement of this brachial artery, measurement of blood pressure. This is the third side we can able to. And fourth side is popliteal artery. So this is where you can see this is exact position of this measurement of this blood pressure. So this is the most we are using sites for blood pressure. And the thing is, next one, so how we are going to measuring the blood pressure, by which articles? There is main two things are there. The first one is sphygmomanometer. So the thing is that types of BB measurement tools. So most probably three kinds of the tools are there. The first, mostly the peoples are using, that is the first one is called as sphygmomanometer. As you are seeing here the diagram, this is the instrument is called as sphygmomanometer. This is one kind of the multiple choice question. This is one kind of the bit for your competitive exam. Which kind of the instrument we are using, or which kind of the tool we are using for measuring of blood pressure? The options will come like that. In that, one of the option is sphygmomanometer. So this is how it looks of sphygmomanometer. So this is having some calibrate glass and containing of mercury. So mercury is here one factor which is going to be heat sensitive type. So that's what we are going to use the mercury. So this is the instrument is called as sphygmomanometer we are using for assessment of this blood pressure. And second one is electronic or digital BP apparatus. So this is called as digitally we are going to be analyzing of this blood pressure. Dear students, I can say compared to manual checking, while we are using the sphygmomanometer, we can use a manual checking of the blood pressure, whereas the second one is a digital BP apparatus. It is a digital. So we are not using manually, so automatically it will generating the blood pressure. I can say most probably the sphygmomanometer is effective and accurate data will come. Is it? So coming to the electronic and digital meter BP apparatus, it won't get such a kind of the accurate data. Still we are using in the some hospital side or some clinical side. So this is the two types of the things we are using. So this session I have explained about what is a blood pressure and what are the sites for measuring of the blood pressure and what are the tools we are using for the blood pressure measurement. And next session I am going to use what kind of the equipments and what kind of the articles and what is the procedure for doing of blood pressure, that I am going to explain for the next session. So my dear students, so thank you so much for following us. Thank you so much for blessing us, because we are getting the positive feedback from you that you are following our medical classes. So thank you so much for that. Still I am asking to you to share your friends, to share your colleagues, to stay your juniors. By that we can convey our information to the all the nursing family students. So that's what I'm going to tell the further next session, equipments of things. So please keep in touch, like and share and subscribe our channel. In that case you will be see our upcoming videos and all. So that's what, please keep in touch. Until that, stay tuned. Thank you so much.